Breast cancer is one of the most frequently seen cancers in this area and in the country as a whole. It's the most commonly diagnosed cancer in women today, other than skin cancer. Breast cancer, if you go back and look at the history, 50 years ago, the majority of women were treated with a mastectomy. So basically, they would remove the entirety of the breast, essentially an amputation for a woman. This would not only lead to some physical and emotional trials for the woman, but oftentimes she was left not feeling whole. Nowadays, women have the choice. There have been multiple randomized controlled trials that have examined women and that have looked at women undergoing mastectomy and a lumpectomy, which is just removing the tumor itself, combined with radiation. And what they found are the outcomes are essentially the same. So nowadays, the majority of women, as long as their tumor isn't locally advanced, oftentimes will have the choice whether they want to have the entirety of the breast removed and undergo a mastectomy, or if they would like to undergo a lumpectomy, just have the tumor itself removed, the breast remains intact, and then we treat usually with 5 or 6 weeks of radiation after lumpectomy, and we expect the outcomes to be the same. With the women that I speak to today, I very much emphasize the fact that they need to undergo routine screening with pap smears. So all women that are sexually active or over the age of 21 need to have a gynecologist that they see routinely. Unfortunately, cervical cancer is on the rise, primarily due to the HPV virus. It is a very curable cancer if we catch it early. Women who undergo routine pap smears, oftentimes if we find cervical cancer, it is caught very early. Usually in women who are diagnosed with locally advanced cervical cancer that have a lesser likelihood of cure, oftentimes have had symptoms for quite some time and just neglected to go see a physician, or they hadn't seen a gynecologist since their last baby was born. Concerning symptoms that women can have that would alert them to go and see a physician would be vaginal bleeding that is outside of their normal period. Any bleeding after sex would certainly be a red flag to come and get checked out. Any unusual pelvic pain or feeling as though there's a heaviness in the pelvis or a mass in the pelvis certainly should alert the patient that they should be checked out by their primary care physician.